2021-2022, which is the cycle that the Massachusetts state legislature operates under. And we came up with these buckets, is what we're calling them. And we have healthcare access, which is our traditional healthcare bucket for insurance coverage, telehealth and telemedicine, kind of the traditional things that you kind of think about when you think about healthcare. But what we really heard from everybody was that they're really concerned about what's happening to patients outside of the hospital. So we included two new buckets: our social determinants of health bucket, which includes housing, food access, transportation, early education, environmental health exposures, and racial equity and social justice, which includes maternal and infant health, juvenile justice, youth opportunities and jobs, lifting caps on benefits, and equitable education funding. And we also have our behavioral health bucket, which is its own category since it's such a pervasive problem today. And we have psychiatric boarding, school-based behavioral health, and behavioral health urgent care on that list. So next slide, please. So what we did with these topics, as you may recall, is attach a series of pieces of legislation to all of these topics. And these are the bills that the Government Relations Office used as the way to get these topics over the line. And I just want to note, as you may have heard us say before, that the topics and buckets, it's not a comprehensive list of everything that we track here in our office, but it is our priority list. And if there's anything on the list that you don't see, it doesn't mean that we aren't following it. But here it is our priority list. So in our healthcare access bucket, our priority bill for this year was an act relative to telehealth and digital equity for patients. This bill would expand telehealth access for patients who either speak English as a second language, or who are hard of hearing, or who may have access issues in terms of the device that they're using or their internet connectivity. This bill had a hearing before the Joint Committee of Financial Services, and we're still awaiting further action on that bill. The next bill that we were focusing on was an act to ensure equitable access to healthcare coverage for children with disabilities. This bill asks the state to expand traditional mass health coverage for children who are not eligible for the full mass health benefits, specifically due to their immigration status in the United States. Currently, children who have a limited form of mass health may not be able to get as frequent prescriptions, or they may miss out on certain healthcare procedures because their insurance just doesn't cover it at this time. So this bill actually received a favorable report from the Joint Committee on Healthcare Financing, which is great news. It means it's going on to the next step, and we will be in touch with additional actions that are needed on this bill to help continue moving this along. Next slide, please. On our social determinants of health bucket, we have some good news as well. In January, the Joint Committee on Education will be hearing a bill relative to universal school meals. This bill would allow every public school in Massachusetts to offer free breakfast or lunch to any child that wishes to access that benefit through their school lunch program. Currently, a lot of schools offer free lunch or even reduced lunch, but not every school does. And this would really take away the stigma that some kids face when accessing the school lunch program, and ensure that every child has access to free breakfast and lunch at their school. So we will be testifying at this hearing, and we look forward to doing that early next month. The next bill that we have, an act to streamline critical public health and safety net programs through common application, basically asks the state to streamline the process that families have to go through when they're applying for multiple benefits across different state agencies. So if they're applying for certain benefits through the Department of Transitional Assistance or the Department of Housing, that they would only have to fill out one form when all of the same information is needed, and then the state would have to share those forms to better to decrease the paperwork that families have to do when they're applying for benefits. This bill had a virtual hearing and received a favorable report and was referred to the House Committee on Ways and Means, which is great news for this bill as well. And we will be in touch with additional action steps on this bill. Next slide, please. On our racial equity and social justice bucket, we were working with coalition partners to on an act relative to expanding equitable access to maternal postpartum care. We know that we can't have healthy babies without a healthy mom. So we were working with a maternal mortality coalition on making sure that mothers who or birthing parents are able to access mass health benefits for up to 12 months after they give birth, because right now there are certain eligibility requirements that may limit the time window in which birthing people are able to access their full mass health benefits. This bill had a virtual hearing with healthcare financing and also received a favorable report from the committee. The next bill that we will be testifying on this week or providing written testimony is an act to increase family stabilization through the earned income tax credit. And this bill will expand the benefit that families receive through the earned income tax credit so that they could have better ability to take care of their children. The next bill is an act improving emergency access assistance for children and families experiencing homelessness. This bill would enable families who are unhoused to when they apply for benefits for emergency homelessness, really reduce the amount of paperwork that they have to provide to the state before they are given a emergency placement, and also asks the Department of Housing to make this whole system a little bit easier for some of these families who are in crisis. We did testify at this virtual hearing on the Joint Committee on Children and Families, and we are awaiting additional action on this bill. Next slide, please. Just to review the state budget a little bit, this is just a sample of some of the programs that we were tracking. Every spring, the state legislature and the governor vote and debate on the state budget. That process will start again in January, but just to show kind of what has happened over the past year, in several categories, there were significant increases in funding, at least through the state budget. For housing services, especially, was important for many of the families that we serve, and also for safety net programs such as lifting kids out of deep poverty. Some of the things that aren't reflected in this is all of the federal assistance that is currently under review by the governor, and there was several other federal packages that may have added on to some of these things, but we just wanted to give a reminder of some of the other work that we track that goes on at the state level that is important to the families that we take care of. Next slide, please. And as I mentioned, the American Rescue Plan Act, or the ARPA, they're made available $3.65 billion in federal COVID relief funding for the state to kind of give one-time funds to address different issues that were exacerbated by COVID-19. And the legislature debated on this bill in the fall, and the governor has the bill on his desk. He actually has until today to sign it or make amendments to the bill. During the fall, the House and Senate had a series of public hearings to hear from the public and have other advocacy groups on what really needed to be included in this bill. And Boston Children's Hospital was able to submit testimony both on the importance of digital health equity and telehealth, as I mentioned on the previous bill, really expanding access for families and access to interpreters and things of that nature, and especially the importance of contributing some of this funding towards behavioral health to stabilize the behavioral healthcare system. Next slide, please. And looking ahead to 2022, as I mentioned, we are still waiting to have a hearing on one more of our priority bills. We'll be following the Ways and Means Committee's deliberations on the FY23 budget, as the fiscal year for the state starts on July 1st. So that will be fiscal year 2023. We anticipate a series of conference committees being appointed for some of these priority legislations, especially around healthcare and behavioral health. And then next summer, we will start to take a look at what we should work on for the 2023-2024 legislative session. And we anticipate sending out another legislative survey, similarly to what we did in the summer of 2020. And we look forward to everyone's participation in that. And we will also be monitoring. The governor has to submit his budget by the 4th Wednesday in January to start that process again. So please keep an eye out for any action alerts related to the budget this spring. Next slide, please. With that, I will pass it back to Alexia. Thank you.
Thank you, Shannon. And Amara already has her camera on. She's ready. So I'd like to introduce Amara Azubike, our Director of Behavioral Health Policy and Advocacy.
Thank you, Alexia, and thank you, Shannon. As Alexia mentioned, my name is Amara Azubike. I'm the Director of Behavioral Health Policy and Advocacy. Next slide, please. So I'd like to start with our advocacy statement, just so that we level set. At Boston Children's Hospital, we are committed to ensuring access to timely and high quality behavioral health care for children and adolescents across the continuum of care. What we like to say is we hope to promote the right care at the right time and in the right setting. Behavioral health encompasses the promotion of social and emotional well-being. It also includes the treatment of mental health conditions, substance use disorder, developmental and behavioral challenges, and as well as trauma-related health conditions. Next slide, please. In spite of that, although that is our hope and our goal right now, there is a children's behavioral health crisis, and children are confronting a growing crisis locally, but also throughout our nation. Right now, there's a shortage of psychiatric beds, so the number of children requiring an inpatient level of psychiatric care has increased over the past several years. And yet there is a capacity shortage. And what you'll see and what we found is that there are longer waits for children with complex needs, including co-occurring autism and intellectual disabilities, co-occurring medical complexity, younger children under the age of 12, and children exhibiting aggressive behaviors. And much of this is because there's difficulty accessing care across the full continuum, including inconsistent behavioral health capacity and primary care practices, a lack of community-based urgent care or crisis options, and it makes the ED become the most accessible place to go. And also much of this is due to longstanding underinvestment and significant workforce shortages. COVID-19 has also increased the need for a responsive behavioral health system with school closures and disruptions in the home and the community. We found that the number of children requiring higher level needs of behavioral health care has increased dramatically since COVID-19. Next slide, please. With that, we wanted to focus our priorities throughout the full continuum of care and to be as comprehensive and robust as possible. So the bills that we prioritized were S107 and H203 related to ED boarding, child ED boarding. And there was a hearing on these bills on October 29th, 2021 before the Joint Committee on Children and Families and Persons with Disabilities. Since those hearings, we've actually had some success. So many of the components of these bills are in the Senate Mental Health ABC Act 2.0, which passed the Senate in November. And what these bills would do would create sort of a real-time data tracking onboarding with bed availability so that the state and stakeholders can have information about needs assessment immediately in terms of bed search capability, but also over time in terms of what are the levels of care that the state needs and how can we make sure that we're allocating appropriate resource. These bills would also establish a complex case resolution panel which would allow the Office of the Child Advocate to convene the appropriate state agencies when there is a patient or a child having challenges accessing care. And so both of those components actually are in the Senate Mental Health ABC Act, and also in the ARPA legislation, the funding opportunity, the funding that COVID relief that Shannon mentioned. It included $7.5 million to actually develop the tracking portal that was contemplated first in these bills. Our next priority was related to an act relative to behavioral health urgent care. The hearing was in July. And what this bill would do would be require DPH to create regulations that would support the implementation of behavioral health urgent care, including requiring providers to provide some behavioral health urgent care. And there was a hearing for this in the summer, as I mentioned, and the ARPA legislation also included funding to support community-based urgent care grants. And then finally, we focused on schools in an act to create a thriving public health response for adolescents. There was a hearing in June. And what this bill would do, it would create sort of the infrastructure to support school-based behavioral health throughout the state. It would support the implementation of regionalized school-based technical assistance centers that all schools and districts can access. It would also require behavioral health crisis plans from the school, which is really a parity issue because there are physical health crisis plans that are required from the schools. And it would support the creation of a statewide advisory council on school-based behavioral health. In the ARPA legislation, there was $1 million set aside to help to fund the creation of the technical assistance centers. And in the fiscal year 22 budget, there was also $150,000 set aside to support the development of the TA centers. Next slide, please. I did mention some of the things in ARPA that supported our legislative priorities, but it also included other investments in the behavioral health space of note. In total, there was $400 million set aside for behavioral health. $110 million was set aside for student loan repayment, which is critically important given the behavioral health workforce shortage. Let's see, and then there was also language to fund one-time costs associated with opening new behavioral health acute care beds in calendar years 2022 and 2023. I mentioned the Senate Mental Health ABC Act 2.0, or an act addressing barriers to care for mental health, which is comprehensive legislation to reform the way behavioral health care is delivered in Massachusetts. It recently passed in the Senate and included really key provisions that I mentioned, including the OCA complex case resolution panel, the data and coordination online portal for ED boarding. It also include a relaxation of DON requirements for providers seeking to expand acute behavioral health capacity, and would require DMH to produce a comprehensive plan for access to continuing care intensive residential treatment programs and community-based programs. And finally, it would strengthen state parity laws, among other provisions. It's quite a large and comprehensive bill. So looking ahead, we will be focused on ensuring that the Senate Mental Health ABC Act passes the legislature, and hopefully it would also include additional priorities related to school-based behavioral health, continue to promote the pediatric behavioral health on the national level, and I believe Amy DeLong will speak to some of this. And then finally, participate in state budget advocacy. I just want to say, I know there are probably folks on this webinar who have really helped in terms of participating in action alerts. and reaching out to your lawmakers on behalf of children's behavioral health. Thank you so much for all that you've done to move the needle in this space. And I think that might be my last slide. All right, thank you, Alexia.
Thank you, Amara. And now I'd like to invite Amy to turn on her camera and unmute. Amy is our Director of Federal and External Relations. Welcome, Amy.
Thank you, Alexia. Happy to be here today to talk about our federal work. We can go to the slide there. And what we have in the slide here, I think these topics are not surprising to anyone. There are the topics that make up our federal priorities for this session. One thing I want to note here is that one way that our federal work differs from the state is that because it's national work, and in that sense, we're like a smaller fish in a bigger ocean. We partner with other children's hospitals across the country who are often experiencing similar challenges. So partnerships with other children's hospitals and organizations that are working on behalf of children's health nationally are pretty important in order for us to be effective on the national stage. So we both develop our priorities in coordination with them and then bring them back to BCH to get input here. So these are the issues I'll be talking about are national in scope. They affect kids across the country, and they also have national or federal solutions, we think. So coming into the year, as Mara just talked about behavioral health, it was a priority not only here at Boston Children's, but at other children's hospitals. And we've worked together with the Children's Hospital Association, our peer institutions on a variety of those initiatives, and some of them I'll detail a bit more in subsequent slides. And many of them are actually coming together in one large proposal that we hope to see introduced soon. But this will continue to be a driving part of our work in 2022 and beyond, I'm sure, both in terms of putting together federal proposals and also getting attention from the national legislature. We've come a long way in 2021, I think, in getting attention to this issue, which is so extreme here and elsewhere. Next on the list, CHGME, which stands for the Children's Hospital Graduate Medical Education Program. We are a teaching hospital, and that's an important part of our mission, training the next generation of pediatric workforce. And CHGME is often my best example of how children's issues in the policy realm are often like we need to be the squeaky wheel because they're just a little bit different. And when it comes to funding the medical education that happens at a children's hospital that's like ours, that's not part of a bigger system that also trains adult providers, the funding comes from the federal government in an annually appropriated way. Congress looks at it every year and decides how much to allocate towards CHGME. That doesn't happen in the adult training hospital, in the adult world. It's an entitlement program through Medicare for other hospitals. So we have to ask every year for CHGME funding, and this year was no different. The federal budget for FY22 is not yet resolved. They've sort of pushed that out and may continue to do so for a while, but we have seen increases in CHGME proposed, which is heartening. And the Build Back Better Act, which I'll talk about momentarily, also proposed a one-time bump for CHGME funding, which is welcome. So good attention there, good momentum there, but we need to keep at it. Also on our list is Medicaid and the children who rely on it. Our state team talked a bit about Medicaid too. It's a federal and state partnership. So it's an area that we work on both at the national level as well as with other states. In Boston, we are a regional and national provider. So we see kids from Medicaid programs in more than 40 different states every year. So it's a huge concern for us that program works well for kids. And it's another area that differentiates the things that we're asking for of our federal government, our federal delegation, than adult hospitals in a policy sense. So Medicaid is an important priority, will continue to be, and NIH support. NIH, the National Institutes of Health, is a federal agency that provides significant funding for biomedical research in the US. Boston Children's is a significant recipient of funds in many different avenues, and we're always working to make sure that NIH is responsive to specific needs in pediatrics. And of course, this includes funding research into childhood diseases, which is an area where funding has been disproportionate. And in more recent years, we've also been very focused on the development of physician scientists, early career researchers who would be focused on pediatrics. It's been identified as a critical area that needs support by folks at Boston Children's and other institutions like ours. So we can move on to the next slide. We've listed a few of the bills that we've focused on this past year and will continue to focus on in the upcoming year. And these on this slide, these are all behavioral health bills. The first one, Children's Mental Health Infrastructure Act of 2021, would provide $2 billion a year in funding to children's hospitals and other eligible institutions to expand capacity, pediatric capacity for behavioral and mental health services, including constructing or modernizing sites of care, which that's a big number, $2 billion a year. This is a national, should it pass, this is a national grant program. But given the work that we're doing and the problems that we've been facing at Boston Children's, we would be eligible to apply. So it's exciting to even have that in legislative form and being considered at the congressional level. So that's one bill. And then the next bill that we've been talking a lot about is the Helping Kids Cope Act, which would also provide funding through grants. It's $500 million a year for 5 years to support a range of community-based activities, things that so the state team talked a bit about things like this and programs that we see here work and are desperately needed. Community health navigators, behavioral health practice integration, telehealth, crisis response services, things of that nature. So that bill proposes to fund programs in that area that we think would be important and good for kids. Both of those bills were introduced in the past year in the Congress and are still on the table, I guess, to be considered as bills are. Another difference between the federal work and the state work is that bills at the federal level can be introduced at any time, whereas at the state level, most bills are dropped, introduced at the beginning of a session, and have a more of a clear path over the course of 2 years to potentially become law. At the federal level, things are introduced anytime, so it feels a bit more haphazard, but also can be responsive to needs in that way. So those two bills were introduced in the last year, and we're working with our other institutions and the Children's Hospital Association to take those two bills and fold them into a bigger proposal that we've been calling the Strengthening Kids Mental Health Now Act, that we expect will be introduced soon. I don't know exactly when, but we hope very soon, by a congresswoman named Anna Eshoo. She's from California and chairs a committee that has a lot of jurisdiction in child health and has been working with folks who led the efforts around those two bills I just spoke about and others to put together a bigger proposal that would, in addition to components mentioned from those two bills, include things like matching funds for behavioral health in the Medicaid program, telehealth flexibilities, care coordination, loan forgiveness, all things that we think are important to meeting the crisis that we're in. And the bill is essentially, when it's introduced, is based on a proposal that the Children's Hospital Association worked with member hospitals to put forward. So we're actually very excited about the pending introduction and the opportunity to rally around this. And I think you'll hear more about that initiative, I hope so, in the next year. So that's our behavioral health agenda for the moment. And we can move to the next slide. Here we have this first bill listed here. The Accelerating Kids Access to Care Act is Medicaid related and specifically related to out-of-state challenges. When we see kids from other states who come here, Boston Children's, to receive care, we oftentimes run into a barrier when it comes to screening and enrolling our providers in other states' Medicaid programs, because it's a state-run, state-administered program. There are 50 different states, 50 different sets of rules. And when it comes to the screening and enrolling of our providers, we've identified it as an area that could be much better streamlined and work more efficiently, both for our providers and also for children who are waiting to come here, sometimes urgently, for care. So this bill would address that issue and create a streamlined pathway for children's hospitals to enroll in out-of-state Medicaid programs, and hopefully make things more efficient and responsive to the needs of kids across the country who are in the Medicaid program. Then we have the PACT Act, which I mentioned our work around with the NIH and trying to make sure we have a robust physician scientist workforce, which is important to finding cures and treating American children, millions of American children who are fighting a range of diseases. So the PACT Act would address a challenge that's been identified where there are less physicians focusing a portion of their careers in research, especially in the pediatric area. There are documented declines, and the number of slots available through NIH pediatrician-focused research training programs has also declined correspondingly. So it would aim to strengthen those programs and encourage more diversity of all types in the field, and include mentors who reflect the diversity of today's early career pediatric researchers. So kind of an exciting bill to be able to be working on in coordination with other pediatric research institutions. And you'll continue to hear about PACT, and we're hoping to move that one forward in the next year. And lastly, on this page, the Pediatric Access to Critical Healthcare Act, the acronym is PACT, is a big partnership with other children's hospitals across the country. That bill would dedicate or provide $6 billion over 10 years in dedicated support for pediatric preparedness response, more flexible critical care capacity, strengthening the workforce, telehealth technology, particularly focused on high Medicaid providers. So good for children's hospitals who serve child populations with great health disparities. And the bill calls for matching requirements. So whatever federal government contributed will be matched by receiving institutions. And it's an opportunity for children's hospitals to work together on these issues that we're all facing in our communities. So that's another one that we're working on in close coordination with the Children's Hospital Association and other institutions like ours. Go to the next slide. The Build Back Better Act, which you've likely been hearing about in the news. It's consumed the attention of Congress for much of this year. It's the big initiative to come back after COVID, and it actually goes well beyond healthcare and certainly beyond children's health, but there are some really important components for us. And a few of them are listed here. The bill's not yet law, and it's passed the House. It's a Biden initiative. It's passed the House, and it's facing sort of a complicated path in the Senate, but it's important to the Biden administration, and will definitely continue to be a big topic in Congress through the end of this year, and I think as the year resumes. So we are happy that the version passed by the House contained a provision to keep the permanency, the Children's Health Insurance Program, to keep that program permanent and not have to fight to reauthorize that every few years. It contains a provision that would require 12-month continuous eligibility in Medicaid and CHIP, a range of maternal health protections that are good for kids, expanded child tax credit. And I mentioned before the one-time funding bump listed here, CHGME funding. It includes a one-time funding bump of $200 million, and that's national, goes across children's hospitals across the country for that program. So we're looking forward to seeing how this bill moves forward, how these provisions play out. On the next slide. This is a bit of a timeline on the Build Back Better Act, because I feel like we've been talking about it forever, and sometimes it feels like not much has happened, but it actually has moved quite a bit, since August 2021, when it was introduced, moved along through the House. They passed it in November 2021, and we sort of put here on our timeline, coming soon, because it's the Senate's turn to look at it, and they have a number of obstacles. The bill could change from what we've seen in the House, so it's important for us to keep an eye, and there'll be times to weigh in from an advocacy perspective on the child health provisions that I just mentioned, to make sure that they stay in there, or if they could even be enhanced. You'll be hearing from us as that moves forward on ways that people can get involved. And the next slide. Our priorities are largely the same. We look at children's mental health, Medicaid, pediatric workforce is an increasingly important priority. Research, the NIH, and infrastructure and sustainability of children's hospitals. So these are the things that, together with the Children's Hospital Association, we'll be working on at a federal level over the next year. So very similar bills and very similar topics to what we've been talking about for the past year, as we try to respond to the challenges that the institution and others like ours are facing. Go to the next slide. Looking forward to the introduction of the Strengthening Kids Mental Health Act that I mentioned, progress in the other bills we've been working on, and the passage of the Build Back Better Act. Those are the things that we hope to see happen in the legislative realm over the next year. And the next year we'll finish out this congressional session. So we will see what happens. And the next slide, getting involved. If you've been a member of the Children's Advocacy Network, come to these events before, or any of our trainings, you may have seen this slide. We thought was worth calling attention to here. ways to get involved. It's like a ladder. You know, we get you in to do some small things and want to work with you to do more. So where you are right now, if you just joined this webinar and you've never done anything with us before, you are on the ladder on the base where it says education and action. So you're attending a webinar. So congratulations, you're on the ladder. And we want you to stay involved, stay on our email list, read our emails and get more involved. There will be many opportunities over the next year for you, no matter what your role is at BCH. If you work here, if you're a parent or a community partner, to get engaged with the work happening in government relations. These actions really build on each other. You can see it goes from attending a webinar like this one to sending an email to your member of Congress, all the way up to we love to work with people when it's appropriate and makes sense to bring their expertise to Beacon Hill or Capitol Hill, share your stories, and try to make a difference for all kids. So I want to encourage folks to stay involved, and thank you for joining us today. And I think that's it from me for now, but I know we have time for questions.
Thank you, Amy. And can Shannon just join us back for the Q&A session? And thank you, Kaylee, for stopping to share the slides. So I know we just went through a lot of information and we have received some Q&A questions, but I'm going to start with the ones we received via registration first. So this one is for the entire panel, and it's just kind of a reflection. So how has the Office of Government Relations adjusted their advocacy practices in the age of COVID-19? And I will send it to Shannon first.
Thanks, Alexia. Obviously, COVID changed how everybody has to work. I think the biggest shift has been to try to understand how we can continue to make everyone here at Boston Children's feel involved from a virtual space when we can't visit the State House, for example, which is still closed to the public. We've obviously moved to a digital world of interacting with legislators through email and webinars and virtual meetings. I think we've done a pretty good job of keeping in touch with them, but it definitely has been a challenge. But I think our team has done a great job at making sure everyone knows virtually what we're working on. I'll pass it to whoever would like to elaborate on that from our team.
I think you got it.
Yeah.
And the same goes for the Hill, in addition to the State House.
Yeah, everyone's shifting.
Thank you. And I'll pass this next one to Amy. So I know you mentioned towards the end different ways that you can be a part of advocacy and advocate. And this question seems to be from someone who is still not sure how to do that in the federal space. So it's, how do you advocate on the federal level? Do you meet with legislators? Are letters written? And will a federal legislator answer my email if I send one?
So we, the Office of Government Relations at Boston Children's, we maintain relationships with the New England delegation. And by that, I mean the offices, including the member of Congress, but also their staff. They all have staff members who work specifically on healthcare policy. And we try to know all of them and be in regular contact when it comes to the group from New England. So the states that we serve regionally with a lot of frequency. So Maine, Rhode Island, New Hampshire, Vermont, those other New England states that I just named don't have a large freestanding children's hospital like ours in their states. So we consider them part of our, they have some ownership of us. It's in their interest to have us be strong. And they are pretty responsive to us and understand that there are kids in their states that need to have access to Boston Children's. So we love having members of the CAN who are willing to reach out through emails or even in-person visits when that is a thing, and hopefully becomes a thing again on priority issues where they can have impact. And we also work in coordination with CHA to reach members of Congress and people from other parts of the country. But all that said, members of Congress, and I worked for one for a long time, respond best to their constituents. So if you send an email, you are likely to get a response. If you send a form letter, you are likely to get a form letter back because of the volume. And if you send a form letter to Senator Warren, she's probably received the same form letter from a number of other people in the state. So it makes sense that her office would develop a form response to it. If you send a personal email or something more, more targeted or more personal, describing the impact of the policy on your life, you might get more attention. I worked on the Hill for a long time for a congressman from Rhode Island and for others in our office who have different experiences, and we're always happy to to work with folks on what is the best way to get your message to the attention of your legislation have an impact in DC. So I hope that answers the question, or starts to.
Thank you, Amy. For the next one, I will pass to Marva. This one is specifically on behavioral health. It's as we close 2021 with many children in the Commonwealth experiencing a mental health crisis and unable to access the care they need, it's difficult knowing that things we've been advocating for have yet to cross the finish line. Do you have words of encouragement?
I do. I would say, although this is a crisis state that we are in, I think a silver lining is the fact that right now in the state and nationally, behavioral health is finally getting the attention that it sort of deserves and needs. And I think that we are all collectively a bit further along past the point of, focusing on stigma. Now is the time really that folks are saying we need to sound the alarm on children's behavioral health. So I think that is the silver lining, is that people are ready to act to make some changes.
Thank you, Mara. And as we're kind of talking about people being ready to act and make changes and kind of looking towards the next year, this one is for the entire panel. It's what policies do you see being important in the upcoming year within your respective spaces? So I will go to Amy first.
I feel like there's some momentum around the behavioral health stuff in Congress, more than there ever has been, especially when it comes to pediatrics in that space at a federal level. So I'm excited by that. It's a shame that it took what it has taken for us to get here to be talking about it, but they are talking about it. And it's the first thing when I hear CEOs of children's hospitals asked what's going on at your hospital, they start talking about the behavioral health crisis. So members of Congress are more aware of it than they ever have been. So that's what comes to mind first when I'm asked that question. Is I think we might finally see something happen. And I don't think they're going to solve it all overnight. I don't think it can be solved overnight. But if we can get some real dedicated supports at a federal level to our hospitals and providers, I think that would be a real win.
And just to piggyback off of that, there are areas of focus in the behavioral health space that I think are moving, including the workforce. We did get a question about that, that there is a significant shortage. So things like loan forgiveness, being able to strengthen programs that extend the workforce that we do have. So there's this program called MCPAP, which basically allows psychiatrists to consult with primary care providers to help them care for children with mild to moderate behavioral health needs. So I think the behavioral health workforce will begin to continue to see improvements on allowing them to be more responsive and robust. And I think another area is school-based behavioral health. A lot of people are realizing that schools are where children are and how important they are, particularly now when so many had to shut down during COVID. So making sure that we're supporting schools to be able to provide behavioral health care.
On the state level, the governor we're anticipating that the governor is planning to file a healthcare related bill before he leaves. We're anticipating that this might continue to incorporate behavioral health into primary care settings, as well as taking another look at telehealth. As many people on this call may know, the current telehealth parity provisions are only in effect through the end of this calendar year. So I think we'll see some advocacy around maintaining telehealth access for our patients within the next 6 months to the year at the state.
Thank you, Shannon. And I am getting a notice that my internet connection is unstable. So if I do freeze, I will pass it to Shannon to take over my responsibilities. So this next question actually will go to you, Shannon, as well. Will the buckets in the state legislative agenda remain the same for the next legislative session?
That's a great question. I think the the main categories, I believe, will stay the same. However, we're always growing and learning and expanding. So I anticipate what's within those buckets to change a bit. Again, we will be sending out a survey over the summer. You're always welcome to reach out to any of us at any time. And just to mention, in the Q&A, there was somebody who had asked about adding childhood trauma to social determinants of health. I think that's certainly something that we can look into. I think I would love to hear more about where this would fit in terms of, I believe that some of the social determinants of health that we already have on there, we view as, you know, food stability and housing security is kind of preventing certain traumas. And then in, you know, Amara's bucket, when we think about the outcomes of childhood traumas, you know, unfolding in a behavioral healthcare setting, but kind of like where some of the traumas, you know, the other things that cause childhood trauma might be a good way to think about it. So I think there's multiple ways we could think about child trauma when we're talking about that. But I would love to hear more from the person if they wanted to reach out. But I will definitely add it to our list. It looks like Alexia, are you there?
I'm back. I froze for
Okay.
a moment, but here I am again. Thank you, Shannon. And I'll just ask Kaylee if you could just drop Shannon's email address in the chat and also potentially the link to sign up for a CAN, because our CAN email is where we will announce our survey, and that's how you'll be kept most up to date on our advocacy efforts as well. Okay. For Amara, how can we as a network enhance our advocacy efforts to ensure children's behavioral health is prioritized at the local, state, and federal levels of government, with the understanding that you and Amy have kind of already touched on that this is something that is present and that the legislature is aware of? Do you have anything else potentially to add?
Yeah, in addition to just, you know, keeping up to date with the action alerts, because we will be sending those out as things move, I think as individuals, we all have a unique perspective that lawmakers want to hear. So if you are a provider, talking about obviously de-identified and HIPAA compliant, what you see in your practice is really important. Making sure your unique story is heard. So when you do get an action alert, we tend to send form examples, but making it as specific as possible, and keeping informed on the issues. I think legislatures and lawmakers, they want to hear from you and from your unique perspective.
Thank you, Amara. And I'll just wrap the final question for Amy. Where can I go to learn more about our federal legislative priorities and keep track of their movement throughout the legislature?
Yeah, I would refer folks to our website, which is going to be updated soon. So keep an eye on it. And then, of course, subscribing to the CAN and checking. We always have a federal section in the newsletter. So that part of the newsletter, and we'll send out alerts as things are coming up. And people can always feel free to reach out to me as well. amy.delong@childrens.harvard.edu. Happy to talk more about it with anyone.
Thank you, Amy. And thank you, Amy, Shannon, and Amara for your time and helping to wrap up the 2021 year of the legislative session. If you have any questions, please reach out. There are some emails in the chat. Feel free to sign up for our CAN as well. And as a reminder, you'll be receiving the slides and a link to the recording of the presentation in the follow-up email. So thanks, everyone. Enjoy the rest of your afternoon.